मैं रंजना आर्टेमिस हॉस्पिटल से बोल रही हूँ। मुझे 5 मई को कोविड डिटेक्ट हुआ था और मैं पास के नर्सिंग होम में एडमिट हो गई। वहाँ पे जब मेरी केस को और फैसिलिटीज़ की ज़रूरत पड़ी तब मैं आर्टेमिस हॉस्पिटल में एडमिट हुई। यहाँ पे मेरा ट्रीटमेंट स्टार्ट हुआ।
मेरा नाम राजीव रंजन है और मैं इनका हस्बैंड हूँ। हमारी फैमिली बहुत ही ट्रैजिक इंसिडेंट से गुजरी इन द मंथ ऑफ मे व्हेन द कोविड-2 वेव वाज इन पीक। 5 अगस्त को इनको कोविड डिटेक्ट हुआ और 5 मई को इनका कोविड डिटेक्ट हुआ था और 6 मई को मुझे व्हेन देयर वाज ए ह्यूज क्राइसिस ऑफ ऑक्सीजन इन हॉस्पिटल, तो वी हैड टू एडमिट एक व्हाटएवर नर्सिंग होम वी कुड गेट इन नियर बाई, तो वहाँ एडमिट किया। बट 9 डेज़ के अंदर ही इनकी सिचुएशन इतनी बिगड़ गई कि हमें नेक्स्ट हायर लेवल का हॉस्पिटल ढूंढना पड़ा। एंड देन we somehow managed an admission in Artemis Hospital thanks to Artemis management, who could allot us a bed in ICU even in that peak period. And after admission we came to know that we have been put under the primary head, Dr. Shivanshu Goyal from pulmonology.
Our patient Ranjana was admitted under us with very severe COVID during the second wave of COVID in India. Now her condition was so critical that despite the best ventilatory supports, she was not showing any signs of improvement. And on the contrary, she even had various complications like pneumomediastinum, what in our language we call as the air leaking out of the lungs. So at this point of time, we took a decision to shift this patient on a machine called ECMO. That's called the extracorporeal membrane oxygenation. It's, in a simple language, a bypass for lungs. The blood is diverted out of the body and passed through a machine where we do the oxygenation and remove the carbon dioxide so that the lungs get rest and they get time to heal. It's a technique which is highly specialized. We were doing it with a team effort. Our critical care team and our CTVS team was involved day in, day out.
Patient Ranjana came to our ICU in a very sick state. She was not able to breathe. She required the ventilatory support, and that ventilator support was very high. And things becomes worsen when she started showing a leakage of air around the lung, and that was the very ominous sign. At that time, we found most of the patient lost their life once they started leaking from the lungs around in the chest. So that was a very difficult situation. So we took the decision to take her on the venovenous respiratory ECMO. With the help of our efficient ECMO team, we started ECMO support.
And 15th she was admitted, and on 19th she got intubated for or ventilator intubation, and then there are lots of complications. We have gone through very high ups and lows all the time, and slowly things deteriorated, and then situation arose where she had to be put on ECMO. So on 2nd June she was put on ECMO as well, and then she started recovering, but suddenly on 15th June or so the whole thing again collapsed. Lungs completely collapsed, and we were almost hopeless at that time.
Subsequently, with a huge effort over 28 days and a fight which was full of ups and downs, if I could recollect one, that during the ECMO there was time when this patient did not show signs of improvement, and we decided that the patient might need to go for a lung transplant. But as luck would have it, lung transplant was not feasible, or she was not being able to transport it. We decided that we will give our best shot and we will try to do something which is out of the box for her. And in a first of its kind, we tried to do an artificial adult surfactant therapy. Surfactant is an element which is there in our lungs naturally, but due to a severe disease like COVID, it gets destroyed or denatured. and the lungs start shrinking. We had to give it artificially by the means of a bronchoscope so that the lungs again open up. This surfactant therapy is also associated with lot of complications and side effects, but with God's grace, everything went smoothly and she tolerated the therapy very well.
And the whole teamwork, that was intensive care doctors, pulmonologists, dietitians, nurses, perfusionists, whole ECMO team work together day and night, every single minute, every single day, every day throughout the week's time period. But after so many days, even we couldn't get a positive forward movement of the patient. Then we use unusual drugs, surfactant, and that after using that drug, she started showing us some improvement. And again, over the a time or the days, we able to remove the veno ECMO, and after that again she required a ventilatory support that again remained so many days, about 25-30 days after removing of the ECMO. Over the time period, again the whole team work committed towards the success of the positive outcome. Gradually patients could able to wean from the ventilator also, and again the physiotherapy and the efforts of the nurses, dietitians, she gradually improved and started walking with the support.
The team of doctors here working in ICU, especially led by Dr. Jeetendar and Dr. Kuldeep, and pulmonology head Dr. Shivanshu, as well as I was thank Dr. Asim Srivastava from cardiac department, who is an ECMO expert. They did not leave hope, right? Neither we left our hope. We kept on working, and the entire ICU team and the entire team of doctors worked very hard. Very hard. They tried each and everything, whether it is orthodox method, unorthodox method in medication. And one thing I would really appreciate, that the entire team was very proactive. Proactive in the sense that in such situation जहाँ ECMO लगता है, ventilator लगता है, collateral damages like various infections, वो बहुत होता है, लेकिन team was so proactive that they could detect the infection the moment it came in. And they kept on changing the treatment plan, medications right at the start of infection. That is why today she is surviving, that we were able to manage infection.
The patient showed signs of improvement. Post ECMO removal, which was almost a month on ECMO, the major fight started, that the amount of muscle weakness and secretions what she had was keeping her back on bed. She was not able to move. She was hardly able to even pick up her hand for a glass of water. So the amount of effort put in by our paramedical staff, physiotherapists, psychological support over the next 40-45 days when she was in the hospital brought her to a stage where she was discharged after 98 days of stay at Artemis Gurgaon. She came in a state where she was not able to breathe. She was on a mechanical ventilatory support, and when she was discharged, she was barely on hardly oxygen, almost like 0.5 liter of oxygen or no oxygen. She was able to walk herself. She was able to do her regular activities, and we achieved a point where she almost became like a normal person, the way she would have been.
So after about 98 days of the hospitalization, we could able to send her home in a fully conscious state, fully comprehension state, and she was walking with support at the time of discharge.
I'm really thankful to the entire nursing staff. I would say that for the first 15 days when we were not allowed entry into the ICU due to COVID, we were also like all other patients, that I don't know what is happening with the patient inside. We were also very much worried are the doctors doing well, are the staff taking care of well. But post-COVID, when the entry was allowed in the ICU, when I started going inside the ICU, when I saw them working, when I saw them taking care of her, most of the ICU nurses have treated her like family. She is fondly known by Ranjana auntie by most of the nurses. I am really thankful to them for taking such an extreme care, as well as the team of the doctors who have led them well from the front. I would just say that it's a God's blessing that she is surviving today in spite of so many things. But the God's plan has been executed perfectly by the Artemis team of doctors, Dr. Shivanshu, Dr. Jeetendar, Dr. Kuldeep, Dr. Seem, and the entire nursing staff of ICU2. We are really, really thankful to them.
उसके बाद आज मुझे मोर देन 90 डेज हो गए और ईश्वर की कृपा और डॉक्टर्स की टीम आर्टेमिस हॉस्पिटल के लेड बाय डॉक्टर शिवांशु और मैं सरवाइव कर पाई हूँ और कल मेरा डिस्चार्ज है और मैं बहुत खुश हूँ कि कल मैं घर जाने वाली हूँ।